In this video, we'll study drugs affecting motor system. The motor system is the highly complex system that controls body movement. The central part of the motor system includes various areas of the cerebral cortex, the basal ganglia, the cerebellum, different nuclei in the brainstem, and the spinal cord. The sensory component of peripheral nervous system carries signal from skin via afferent neurons to spinal cord, and motor neuron carries signal from spinal cord to motor end plate and then to muscle. The peripheral part includes the peripheral motor nerves, afferent nerves from muscle spindles, the motor end plate, and finally the skeletal muscle. Muscle relaxants are the drugs which relax skeletal muscles by acting at neuromuscular junctions. Muscle relaxants are classified into neuromuscular blockers and spasmolytic drugs. Neuromuscular blockers are divided into non-depolarizing and depolarizing blockers, and spasmolytics into central and peripheral spasmolytic drugs. At neuromuscular junction, there is presynaptic terminal, sarcolemma, synaptic vesicles, acetylcholine receptors and mitochondrion which help in neuromuscular transmission. Muscle relaxants are used for muscle spasm and spasticity, facilitate intubation of trachea, optimize surgical working conditions and treatment of seizures and convulsions. Levels of muscle relaxant intervention: spinal cord, neuromuscular junction and muscle cells. Muscle relaxants, depolarizing muscle relaxants also called agonists. Neuromuscular blocking drugs produce excessive depolarization of motor end plate by causing excessive stimulation of neuromuscular receptor. Succinylcholine mechanism of action: physically resemble ACT as acetylcholine receptor agonist, not metabolized locally at NJG, metabolized by pseudocholinesters in plasmadepolarizing action persists ACH. Continuous end plate depolarization causes muscle relaxation. Clinical use of succinylcholine: facilitate intubation, onset 30 to 60 seconds, duration 5 to 10 minutes. Non-depolarizing muscle relaxants, also called antagonist, neuromuscular blocking drugs, prevent access of acetylcholine to its neuromuscular receptor and prevent depolarization of the motor end plate. Non-depolarizing muscle relaxants: long-acting pancuronium, intermediate-acting atracurium, vecuronium, rocuronium, cisatracurium, short-acting mivacurium. Non-depolarizing muscle relaxants: mechanism of action: all bind nicotinic acetylcholine receptors and competitively block acetylcholine, thereby preventing muscle contraction. Central muscle relaxants can be memorized by mnemonic CMR. C for chlormexinone, crisaprudol, chlortzoxin. M for mefenecin, methocarbamol. C. CNS disorders associated with spasticity, that is hemiplegia, multiple sclerosis. M. Manipulation in orthopedics, that is setting of fractures and dislocations. R for receptor-acting drugs, increase GABA transmission. Benzodiazepines act on benzodiazepine receptors linked with GABA receptor. Baclofen act on GABA receptors, relieving of muscle spasms, that is trauma, tetanus, torticollis. Central muscle toxin: botulinum toxin or Botox is a poison that produces muscle paralysis. Botulinum toxin, mechanism of action: enters the presynaptic terminal and binds to acetylcholineous acetylcholine from entering the synaptic cleft. Toxin serves as a block at the neuromuscular junction, can be administered to a specific muscle or group via local injection.
The end. Thank you.